at the current situation, we face considerable risk of the healthcare system being overwhelmed. That means that we do have to continue with the stabilization measures beyond 25th of October for another month.
Good evening, I'm Haryanto Diman. Citing the continuing pressures on Singapore's healthcare system, the COVID-19 Multi-Ministry Task Force announcing that the current COVID-19 curbs will be extended until November 21st. They were initially scheduled to end on October 24th. However, not all measures will remain static throughout the 4-week period. They will be reviewed at the 2-week mark and adjusted based on the community situation.
We know this is a difficult time for everyone. In many ways, I would say this is probably the most difficult phase in our journey through COVID so far. But this phase will not last indefinitely. At some point, the wave will peak. We will also have better immunity against the virus as more people get exposed to it. And we will have more people getting boosters over the coming weeks. So let's continue to have faith that the situation will get better. And in the meantime, we seek everyone's understanding of why we need the measures that we have today, and also your support to protect, importantly, our healthcare system and our healthcare workers.
Cases continuing to climb in recent weeks. More infected persons are being admitted into hospitals. These are putting pressure on public healthcare capacity and manpower. Health Minister Ong Ye Kung spoke about the need to allow more time for the situation to stabilize further and to protect the healthcare system and the workers.
Our hospitals and healthcare workers continue to come under pressure. Our 2,000 isolated rooms are 81% filled. Queues have formed for COVID and non-COVID patients needing hospital beds in certain hospitals. We have stood up 207 ICU beds. 71 are occupied by patients who are intubated. That means they need ventilators to help them breathe. They stay an average of 15 days, but the longest they stay up to a month. There are another 75 who are not intubated but have been admitted to ICU because they require close monitoring and treatment by ICU-trained healthcare workers to prevent further deterioration. The DMS mentioned it in our last press conference. So the workload on healthcare workers and hospitals is therefore very significant. Our hospitals and healthcare workers will need the help from the rest of Singapore to keep caseload steady, not overwhelm the system, so that we can continue to do our best to give proper medical care to all patients, COVID and non-COVID.
To help affected businesses tied through this extended period, the government will extend support measures costing $640 million, including 25% wage support for sectors like F&B and retail. Now, the task force will hold another press conference later this week. In the meantime, visit straitstimes.com for more on the announcements. You can also watch today's press conference on the Straits Times' YouTube channel. And remember to subscribe by hitting the red button below. I'm Haryanto Diman. Stay safe and I'll see you soon.